21st Adventure in Brain Injury. This episode is brought to you by Minnesota Functional Neurology and Chiropractic. They are excellent at serving concussed patients and anyone with TBI or other brain-related disorder. Check them out at mnfunctionalneurology.com.
Cavin, when you were meeting with the team at Minnesota Functional Neurology, did you get to meet their therapy dog, Burr?
I did not get to meet Burr.
No, he looks absolutely adorable in his photograph online. He's got his beautiful soft face and those beautiful eyes. I think he'd make anyone feel better instantly.
I mean, I already feel better just looking at him.
It's true. There's some heart there.
I did meet Dr. Eric, and I met Dr. Lori, and of course, I met Dr. Jeremy Schmo.
Yes.
And I really enjoyed all three of them, and have a lot of faith in the rest of the team, you know?
Yeah. No, I think Dr. Schmo is running a pretty tight ship, and everyone in that clinic is great to entrust with one's recovery.
Awesome. We are also currently looking for sponsors, so if you or your company or your clinic provide excellent care for neurorehabilitation and brain optimization, we would love to connect with you. You can go to feedabrain.com/sponsor.
And Cavin, let's be very specific about the individuals, companies, and clinics we are inviting to join us on our adventure. We're looking for individuals or clinics who provide excellent care. We're looking for individuals, companies, clinics who build superb nutritional supplements or food products. And here's something I think you'll have a comment on. We're also interested in a company that might provide real food gastric feeds for patients.
Absolutely. I mean, gastric feeds and hospital nutrition in general, but especially when it comes to gastric feeds, the main ingredients are corn syrup, soy protein isolate, calcium caseinate, not real food at all, and very inflammatory food at that. So, yes, I am absolutely interested in having real food gastric feeding companies contacting us as well.
Fabulous. I think we're going to make a real difference. I'm very excited. And our goal of 1 billion brains and 1 billion lives, well, those 1 billion brains, if we help them, they're going to contribute to far more than 1 billion lives.
Far more. So 1 billion brains, 10 billion lives.
Let's go for it.
That's what the motto should be.
Let's do it.
All right. Well, let's get on to the show. You ready for this?
I'm so excited.
All right. Hello, everyone. Thank you for joining us on the 21st episode of the Adventures in Brain Injury podcast. My name is Cavin Ballister, and with me is my co-host, Michelle Momberg. How are you, Michelle?
I'm extremely well and excited to be here yet again, Cavin.
Who do we have with us today?
We are so fortunate to have in our midst Dr. David Traster.
David Traster is pretty high on my list.
I couldn't tell by the thrill you had in your voice when you called me. Michelle, guess who I talked to today? So we are so fortunate to have these professionals open up their expertise, their time, their schedules, so that we can bring really brilliant information to listeners, patients, doctors, lay people, interested people around the world. I know that we've got listeners in Italy and France, which is really exciting, Cavin.
That's awesome. Yeah, I like talking to people about brains to people with brains.
Well, let's tell our audience a bit more about Dr. David Traster.
What have you learned about Dr.
Well,
Traster?
what have I learned? Oh my gosh, clearly not enough. I mean, there's a lot to this gentleman. Anyone can find him online at southfloridaintegrative.com. And what caught me right away, because I am a woman of words, was the fact that this man had a beautiful quote that just captured me. And this quote is, There is no scientific study more vital to man than the study of his own brain. Our entire view of the universe depends on it. So said Francis Crick, a British scientist, neuroscientist, best known for his discovery with James Watson of the DNA molecule. So, I mean, this Dr. Traster, he's going deep. He's going way back and he's going deep, and he has a reverence for those who have come before him, clearly. And he's building upon the work, the foundation that they've laid down. So what you enlightened me with was Dr. Traster's powerful story about why he's become so passionate about this work. And you and I speak that same language because we are here because of our personal experience. So it's really wonderful to know that we've got professionals in the field so passionate about this work because of their own experience. But first, let's get to all of the spaghetti. This Dr. Traster has a full plate of spaghetti, lots of educational credential behind his name, a good number of letters.
We were talking about the spaghetti, and so the spaghetti is the long list of letters after people's names. That
right.
Let's give some respect to the spaghetti, because that was work. People worked so hard for that spaghetti.
It's brain food. It is brain food, Cavin. A plate of spaghetti.
I don't know. Spaghetti, I don't eat spaghetti too much, and I'm Italian, and it's because it's not brain food for me.
Let's go with, you can create vegetable noodles. You could have seaweed noodles. Let's expand the box. Break it out. All right, so let's talk about this Dr. Traster. He was mentored by the world-renowned Dr. Ted Carrick, which clearly had to be life-altering. In his brain health book, Dr. Datis Karazian calls Frederick Carrick the father of functional neurology. And I don't think David Traster could have gotten any closer to the source of such life-changing knowledge than standing right beside him. So now Dr. David Traster is a licensed chiropractor with a master's degree in sports health science. And he has some notable designations. We really like these. He's a diplomate in chiropractic neurology. He's a fellow in brain injury and rehabilitation. He has a certificate in applied kinesiology. He's a personal trainer with a specialty in performance enhancement and corrective enhancement, which is phenomenal. I mean, this gentleman has really paid attention to a lot of details of the human body. He shares his knowledge consulting for doctors in the USA and abroad. He's an assistant professor for the Carrick Institute of Graduate Studies, developing a course on dizziness and vestibular rehabilitation, taught in Florida and Amsterdam. And currently at his clinic, South Florida Integrative Health, he's consulting with doctors and patients from around the world, which is really exciting that this knowledge is being shared so widely. And the wonderful thing about being in South Florida is that Dr. Traster offers his patients a bonus. Those who come to see him get that beautiful Miami experience and weather to enhance their recovery. A little vitamin D for you folks.
So, yeah, welcome, Dr. Traster.
Welcome.
Thank you so much. That was too nice of you guys.
Oh, it's truly our pleasure to have you and your plate of spaghetti.
There is a powerful story that brought Dr. Traster into this work. So let's talk about that. Let's set the scene back to your childhood. What happened when you were 13?
13, yeah.
So growing up, my family was pretty neurotic into basketball. That's pretty much all I did all the time was play basketball. And I was at a summer camp when I was probably around 13, and I was in the top bunk bed. And, this is probably back in maybe the early 90s. And, bunk beds really didn't have barriers, so it's very easy to kind of fall off of them. So I was in a sleeping bag, and I guess my legs were a little bit hanging off. And next thing you know, I did a flip off the top bunk bed, hit my head on the bottom metal bunk bed, and cracked my head open, and Pat was knocked unconscious for 2 minutes until somebody woke me up.
Oh, no.
So that was my first experience of a head trauma. So I was in the middle of nowhere summer camp. So I got rushed to the health cabin. and I don't know who did it, but somebody stitched my skull up with I don't know how many stitches, put my skull together and said, "You're fine." So,
no kidding.
no MRIs, no CT. At this time, concussion, no one talked about concussions unless it was a really major head trauma. So the concussion wasn't even a thought in anyone's mind. And to be honest with you, the next day I went out and scored 32 points in a basketball game. So
For heaven's sake.
I wasn't that, I mean, I functionally was still not that bad. And what happened was, because it was a metal bunk bed, I then got given a tetanus vaccine.
Of course.
And so the day after the concussion, and we all know the first things after concussion, your barrier systems open up. So your gut barrier, your brain barrier, all your barrier systems just really open up. And then to be given a tetanus vaccine at that time, you know, it's one of those things, risk versus benefit. You know, you can make a really good argument that despite the risk, that the benefit of not having tetanus is worth it. You know, so this isn't an anti-vaccine conversation. It's just a matter. It's just what happened. So
well, let me stop real quick and just say what you mean by opening the barrier systems after an injury.
Yeah,
so after a brain injury, you know, we have a barrier system for our digestion, which is getting the nutrients across and into the bloodstream. We have a very tight filter there. And after a head injury, that barrier system tends to become more permeable. And the same thing happens with the brain. We have what's called the blood-brain barrier. And so after an injury, that barrier that separates all the ingredients in the blood that may or may not be beneficial for the brain, and it selectively is permeable, or it allows certain particles in and keeps other particles out. And that also becomes more permeable after a brain injury.
Absolutely. I explain it to my patients like this. The biggest barrier system that you have in your body is your skin. Your skin is your barrier system that doesn't let things outside of your body into your body. So when you start thinking about your gut and your stomach and your intestines, think about, we talk about how the immune system, 90% of our immune system's in our GI tract. And why is that? Because we're constantly putting external objects into our GI tract. So we really, we need a huge immune system to really figure out what is good and what is bad. And just like the skin protects things from outside of our body to get in, you could think of a type of skin that's a little more permeable. It lets very small, specific things through our bloodstream. So when you start looking at anytime, I don't care what it is, anytime you inject anything into your bloodstream, the goal is to bypass these barrier systems to allow more substance to hit the bloodstream.
Right.
So that's kind of the object, but obviously, or the objective, but obviously after a head trauma, these barrier systems become leaky. So it's almost like you have holes in your skin, and all of a sudden objects that are maybe usually are too big to get through the barrier systems now leak through. And then that leads autoimmunity and all types of problems that a lot of people are living with today.
Interesting. Yes.
So that's what happened. And so what happened was, after the tetanus shot, I was knocked out in bed for about a week. I couldn't get out of bed. I was passed out. And then, I started to recover. But I realized from the age of about 13 to 17, I was pretty functional, but I realized my digestion wasn't as good as it used to be, and started getting some mild digestive complaints. I realized I started getting a little more mood swings, maybe having a little more anxiety. And at that time, you're 13, 14, 15. It's really hard to tell whether that's the head trauma or is that just, a young boy going through puberty.
Exactly.
So it's really hard to say what is what, but I can tell you, looking back now, I think the head trauma really caused the beginning of a lot of problems I ended up having later on in my life.
Sure. And now with the research that has come out over the last, decade, I will say decade, because I'm going back just that far working with that content. Everything you're talking about now is almost common knowledge to anyone who's doing the reading. But when this happened to you, no one was the wiser.
Exactly. At that time, it just wasn't talked about. And what I realized was I just had to work a little harder. It used to come a little more naturally. I had to practice a little more. I have to work on my basketball a little more. and I just do things a little harder, which was fine because my work ethic just allowed that to happen.
Yes, well, and then you went on to play competitive basketball.
Yeah, I worked up and I was a Division I prospect. And what happened was the summer before my senior year, probably was playing the best basketball of my life. I was at Eastern Invitational Basketball Camp. And then I got injured. I had tore my shoulder, tore my labrum. And, it was a little bit upsetting, but I went and got surgery from the New York Giants football surgeon, Dr. Warren, great surgeon, in a great hospital. Everything went well with the surgery. The shoulder is fine. But I woke up from surgery just feeling completely different. Mentally different, physically different, fatigued. I went from playing basketball every day to having no interest in basketball anymore. I went from running around all day to being fatigued, joint pain, just pain all over my body, and just physically and psychologically and emotionally just completely different. And it happened like a snap, like completely woke up from surgery and I just was a different person. And I had no idea why. It took me a long time to have any idea of why that could happen. So I went, well, everyone else did. My dad's actually a pharmacist. So we had connections to some of the best doctors. So I went to some of the best hospitals, some of the best doctors who I have nothing but respect for. I got given everything from irritable bowel syndrome to chronic fatigue to lactose intolerant to psychiatric disorders, one after the other, GERD, just everything you could think of, and nothing worked. I just kept getting worse. None of the medication worked, and it just got worse and worse and worse. And from about 17 to age 25, I was pretty much in bed. I'd wake up. I went to school at Boston University, so I'd wake up, I'd go to class, I'd get back from class, I'd just go to sleep. I was just too tired. I was too fatigued, and it was just living life was too much energy for me. I could do a little bit of it, and then I would just be drained.
So you said something about a psychiatric diagnosis at one point?
Yeah, it's one of those things where, look, the way the health system is right now, it's very objective measurements.
Yes.
So if you go to a doctor and you know what, the MRI is fine, the CT is fine, the endoscopy is fine, the colonoscopy is fine, the blood work is fine, they're put in a box where on their end, they have to follow rules that they abide by. And they abide by certain rules. So I'm way past the idea of being mad at the healthcare community or doctors. Everyone has their own box, And so they got put in a box where for them to fit in their box, diagnostics were clean. It must be psychiatric. And remember, this was still about 10, 15 years ago. It must be psychiatric because all the testing is fine.
Yes.
Right.
So there were times, but I'll get to, where I had to have conversations with my parents about them trying to put me in a psychiatric ward because all the doctors told them that I was fine and it was in my head. And I went from a basketball player to being sick in bed, and my parents got put in a tough position of who do they believe.
Of course.
So is a diagnosis based on elimination? Like, well, it's not this, not this, not this. It must be this, which we can't really say it's not that. So it must be that.
Absolutely. And the hardest part for me, to be honest with you, was personally to have a conversation with my family who knew me my whole life and have them believe doctors who don't know me at all.
Yes.
Tell them that it's psychiatric, but their own son overnight completely changed. How could that, that was a tough time,
Yes.
So I was 25. When I went to school, I stopped playing basketball. I actually was into music, so I DJ'd in college. So I worked as a DJ, nightclubs. I sold actually mixtapes at different bodegas around the world. At the time, there were a lot of mixtape websites, and that's where I made money in college.
I just want to say that I may have bought one of your mixtapes while I was in Brooklyn. I bought some bodega mixtapes.
Oh, I love it.
Trust me, every 2 weeks I would drive from Boston, New York, and go to all the African bootleggers that worked all the bodegas and sell them corner after corner. This is what I did every 2 weeks,
Yo, that's gangster, Dr. Traster.
We all have a history.
So that's the path I was on. And then I did audio engineering. I worked in studios and I worked with different hip hop artists, R&B artists. And I did that for about a year or two after college. And my health
We are pretty similar. Did we talk about this?
I don't think so.
I used to do audio engineering, and I ran my own recording studio in New York.
Cool.
And did sound equipment rental as well.
Nice.
So yeah, we were kind of both doing similar stuff.
Absolutely.
Destined to meet, and who knew that brains were going to bring you together, boys? So carry on with that story, Dr. Traster, please.
So let's just say the health kept getting worse, and hip hop music studios aren't the most conducive place and location for improving your health. So I got to the point where I said, you know what, although I enjoy this, my work hours were like 9 p.m. to 5 a.m. You know, like it was just crazy. So I decided, you know what, I've worked out my whole life. Although I physically couldn't do it, I knew how to train, and I decided to become a personal trainer. And I said, at least if I put myself in that gym and the environment, it forces me to be in an environmental context that promotes me to try to force myself to work out. Even if it's 5 minutes, I don't care.
Yeah,
5 minutes is a lot better than 0 minutes.
Absolutely.
So I became a personal trainer. I worked in a very high-end personal training studio in Manhattan. And it was really a lot of actors, actresses, models, Turkish rugs on the floor. And I did that for about 2 years. And then I had a client, and the client knew I was sick. And she said, look, I was really sick for 7 years. I went to this chiropractor in New Jersey. He did some weird German homeopathy natural stuff. And to be honest with you, I'm so much better now.
Oh, wow.
Now, at that point, look, this is when I was around 25. I was sick at that point for about 8 years. I never once really tried any type of natural anything.
Okay.
No, nothing. So at that point, I said, okay. I kept that in the back of my head. At some point, maybe I'll go with that guy. And I kept, at that point, I still wasn't open-minded enough to even try anything natural because I came up as I'm a pharmacist. If that stuff worked, why wouldn't everyone do it? Why wouldn't everyone know about it? I grew up very confident. I knew it. I thought I knew a lot, so if I didn't know it, why would it work?
The more you know, the more you realize you don't know, though.
Absolutely. So at that point, I got referred to a medical doctor in New Jersey, Dr. Gadroic, who's a great natural doctor. She's a Harvard medical doctor. And she was the first one that actually mentioned the word Lyme disease.
Oh, wow. Okay, here we go.
And I'm from North Jersey. I went to basketball camp every summer in the Berkshires in Massachusetts. I went through Connecticut. I was in the heart of it. And no one ever mentioned that. Because, again, the history, I never saw a tick on me. I never saw a bullseye rash. The history didn't add to it. But in the big picture, it was worth testing for.
So what is Lyme disease?
That is a great question.
Yeah.
So what do ticks have to do with Lyme disease?
It really depends on who you ask. And we're going to spend some time on this today about ways to test it, ways to treat it. But reality is, according to the government and our federal agencies that really tell us what is health and what isn't health, Lyme disease is from a tick. The tick usually feeds off something like a deer. And in the blood, there's these little spirochetes, which are like kind of spiral types of bacteria.
Spirochetes.
Spirochete. Mm-hmm. It's like the most common spirochete people would hear of is syphilis. Although Lyme disease isn't syphilis, but it kind of acts in a similar way.
Okay. Spirochete sounds like a J.R. Tolkien character to me.
But not nearly as fun.
You should think of spirochete like a screw, meaning that it's like a screw, and it actually moves faster in tissue than it does in your bloodstream.
Wow.
So spirochete can move faster in human tissue than in the blood, and it doesn't really like to be in the blood, which is one of the problems in blood testing for Lyme disease, is the spirochete wants to be in tissue.
Oh, gosh.
Because it likes to go and dig into tissue and live in these tissues. It really is not hanging out in the blood as much. These co-infections might be. And you might find it, but the spirochete could also change forms into different types of forms. So it's not always a spirochete form, which makes it tricky.
It is a Tolkien character. It is.
It's a tricky thing. So on the most basic level, according to our government, it's a very easy diagnosed bacteria, and it's very easy to be treated with about 2 to 4 weeks of antibiotics. However, if you look at people in that field and people who live in that area, they would firmly disagree with that, saying Lyme disease is actually very difficult to accurately diagnose. And it's actually very difficult to treat accurately. So there's a big divide. So if you look at my clinic now, the majority of my clinic is head trauma and Lyme disease. And they are some ways so far apart, but some ways so close together as far as such a great area still in medicine. And there's still so much that we need to know about it. And yet one's a real chronic infection and one is physical trauma. So that's kind of the two. So I got diagnosed with Lyme disease. She referred me to one of the top Lyme doctors in New York City, because I was living in New York City at the time, Dr. Raxlin, who was just a great doctor. Got put on long-term IVs, medical, pharmaceutical drugs, and did it for about 3-4 months with a PICC line. A PICC line is pretty much something that goes in your arm, and it's a tube that goes directly to your heart. So the medication can really get direct to your heart, so you really know it's getting there. And
that is serious delivery of medication.
Serious, you do.
And we're talking antibiotics straight through a PICC line.
Yeah.
Straight through a PICC line. So and we're talking about long-term IV antibiotics straight through. I did the orals already. It didn't work. It didn't do anything.
Right.
So we tried that. It felt no better. So we started doing that, and there's some things that started feeling better. It wasn't great, but I started feeling a little better, a little more energy, thinking clearer. And about 4 months into my treatment, the actual PICC line got infected, and I got into septic shock, started having a seizure. I had these little seizures, like 1-2 minutes throughout the time. And I kind of blew it off. That's nothing.
Dude.
And then one time the seizure lasted an hour, and I said, okay, I think this is enough.
Oh.
So I called my aunt and uncle at the time. My parents weren't around. I got rushed to the hospital, realized the PICC line wasn't infected. They had to take out the PICC line, put a new PICC line in to treat the old PICC line. And at that point, I remember this aha moment, what is going on? This is just crazy. There needs to be a better way, because at any point this therapy could kill me.
Right.
And again, there's nothing wrong with that therapy. That therapy work is great for some patients, but at that point in my life, I was like, there's just something going on where if the PICC line was going to work, it would have worked. I'm not ready to put a second one back in. So after that experience, I said, maybe I'll try natural medicine. So that's what led me to that. And I called the chiropractor in New Jersey.
Yes.
And I gave him a call, and I went in, and it's the brain scan in New Jersey, Dr. Andy Patak. And I credit all those doctors for saving my life, but I credit this doctor really. He's the one that really saved my life.
He brought you back. Yeah, he brought you back.
I went there and I said, if this guy says anything, I've never been to a regular chiropractor, let alone anyone who does any type of functional medicine or anything else. And so I went in saying, if this guy says anything weird, anything crazy, I'm walking out. I'm just getting out here. I'm not paying him a dime. This guy is a scam artist, but what do I have to lose? I was at that point, I was at the end.
Right.
So I went to him. He's one of the few people that made sense. He gave me a couple of things which I completely didn't believe in. But I said, you know what? I've tried everything else. Why not try it? The stuff I believe would work didn't work. So just why not try? It's not going to work, but it wasn't too expensive. Let's just give it a shot. And it started working.
So what was the stuff that you didn't believe in that he prescribed?
He gave me homeopathy.
Mm-hmm.
He gave me herbal medicine. Different herbs. He gave me electromagnetic type treatments with different rife machines and things like that.
Yes.
He gave me just things like different types of just energy. I call it energetic medicine.
Yes.
So that's where I looked at, and when that started working and I started feeling better, I kind of had to look at myself and say, if what I believed and what the government said about at least Lyme disease turned out, at least in my case, to not be true, and things they said were not only didn't work, but were scams, ended up working, what else did I think was true that may not be true anymore? And that whole experience really changed my whole perspective on the world, saying, you know what, I'm willing, and I still am, I'm willing to listen to everybody about anything. I might not believe you, but I'm listening to it, because if my belief ends up being wrong somewhere down the line, and I don't have an option B or C or D, then I'm stuck.
Yes.
At least if I have a lot of different ideas and options, I keep my mind as open as possible and just listen to everybody. Then then my experience could take me different roads, but without listening to people, I don't have roads to go on. I'm stuck in a dead end.
We were talking to Dr. Shidlovsky in the last episode about the place of curiosity versus a place of knowing. I said somebody who knows that they don't know everything and knows that anybody that thinks they do doesn't even know enough to know they don't know it all. And I think that's a really important place to be in, is that, you know what? You don't know it all. And the more you know, the more you realize you don't know.
Absolutely.
And so somebody who knows that they don't know and they are curious rather than what's the word I'm going for? Arrogant. Rather than arrogant about their knowledge, that's a place we want to be. And as a patient, that's a place we want to be.
And there's a fine line as a patient between curiosity and desperation.
Yes.
And I was look, I've tried a lot of therapies that, looking back at it, and even at the time, were completely ridiculous, completely crazy. But I was at the point where I know where to go. I mean, I've worn copper pyramids in my head. You know, I've put, who knows, God knows what type of stuff in my body, you know, because at that point, you know, like, you just, again, how bad could it go? You know, it's either going to work or nothing's going to happen. At that point, I don't care if I look like a complete idiot. You know, what I have to lose at this point? I have no life left, you know?
Yes.
So I went to that chiropractor, things started working, and this is where it got dicey, because now my paradigm shifted, but I wasn't healthy enough to really keep employment. So I had to rely on my parents in my mid-20s on finances, which sucked. You know, it was it just was terrible, you know, and it was really not where I wanted to be. You know, I assumed to be playing pro basketball in some country, whether America or overseas. Like, my whole life was set, right? And everything changed, and I didn't have a plan B, and I didn't know where to go. So now I had to talk to my parents about helping me buy things for my health, which they completely didn't believe in.
Of course, as pharmacists, yes.
Yeah, pharmacists, and, you know, and my mom is very big into mind-body medicine, so it wasn't, and I love my mom to death, but it wasn't a stretch for her to believe that my injury and my loss of basketball is the cause of all my problems.
Right,
you know,
right, sure.
Not saying that wasn't a factor, but for her, that was it. So when all the doctors said it was psychiatric, I mean, that fit her model. And my dad's model was the pharmacy model. So, you know, so the model I ended up getting better on was neither one of their models. And it got to the point where they didn't jump on funding or financing my therapies very quickly. I'll put it that way. You know, they were still in the middle. And I got to the point where I had to sit down with my brother and my parents and have the conversation and said, look, I can't live like this anymore. I literally would rather be dead than to be in pain 24/7 lying in bed, because this isn't life. This isn't living. This isn't the way that I can't imagine another 5 years of this, let alone another 1 year, let alone another 20 years. You know, so at that point, I think my parents realized the desperation I was in, and that this one thing that they didn't believe in seemed to get me better. And 9 years later, maybe they should give it a try, which I love them to death for still doing that. And they bought me, you know, some of these machines and some of the supplements, and that was the beginning of getting better. And then I actually was going to go into medical school. So I was actually starting to apply to medical school. My whole thing was Lyme. So I was going to be a Lyme doctor, because I could do the medication, I could do the natural supplements, I could do everything.
Right.
And then what happened was I saw a few great Lyme doctors get their license revoked for treating Lyme outside of what they said their scope was, as far as treating it for too long.
Oh, gosh.
And I looked at that, and I looked at the fact that, you know what? I've got nothing but respect for medical doctors. They're extremely intelligent. They do a great job with the tools that they have, but it didn't work for me. So my idea was, this chiropractor helped me. There's a lot of therapies obviously people aren't aware of. What if I just go to chiropractic school and just be focused on learning every single type of thing that could help somebody outside pharmacy and surgery? So drugs have a place, surgery has a place, there's no doubt about it. But what if I just try to find everything else outside of that to kind of fill in the gap of where these chronic diseases really live in, to see if I could really help people at a higher level. And I just went right to chiropractic school, and starting day one, I started taking seminars, and I started learning as much as I can of how to help people in a little more of a natural way. And so I went to chiropractic school, really being a Lyme doctor. I was doing functional medicine, nutrition, learning every way to treat Lyme and chronic infections. And what happened was, about a year into my program, there was a hockey player, a Canadian, named Sidney Crosby. And Sidney Crosby was really, he was one of the top hockey players in the world.
Yes.
At the time, even back then, he was the Golden Boy. He's a little older now. But he was out concussed for about 9 months, maybe a little more. And he had the best medical staff at his aid in Pittsburgh, and was pretty much told he had to retire at a very young age.
Yes.
Like, you had these concussions, we can't get you back on the ice. Your symptoms aren't going away. Because at that time, it's still not so different now, but at that time especially, it was a dark room and wait. I'm not talking about any therapy. It was sit, dark room, and wait. And once your symptoms get better, we'll slowly bring you back to life. And once the symptoms come back, you're back in the dark room. So that's where, as an athlete, that's probably one of the most frustrating things to deal with, because you want to control what you can control. So you want to be able to have control, how you practice. How do you get from point A to point B? And you want to work hard at it. And now you're telling high-level athletes not to work at all.
Yeah.
Just relax, sit there. And so he came to see Dr. Carrick in Atlanta, the school I was in.
Yes.
And in a day and a half, Dr. Carrick had him back on the ice.
Isn't that something?
Wow.
Remarkable.
And
Remarkable.
No, be honest. Tell me.
No, I was going to say, I'll be honest with you. Like I said, I listen to everyone and I look at everything, but I try to remain healthy skepticism.
Mm-hmm.
So it took me a few times to watch Dr. Carrick work to believe he wasn't a scam artist. Because you hear about Dr. Carrick, and he's a big researcher. He invented a whole field of pretty much rehab. And you really think he's going to come in and be this dull researching guy, and he's the exact opposite. He's just his huge personality, just extremely friendly, funny, humorous guy. And it's one of those things where he's joking around with the patients. I'm like, is he scamming these people? And then, they're getting better, but like, why are they getting better? And it took me a few times to realize this guy's the real deal. Mm-hmm. And all of a sudden I started looking and saying, wait a second, because I had energy medicine, chemical medicine, and now this guy is doing eye movements and spinning people in a rotational chair. Right. And people are getting better. Like, what? What is that? It didn't make any sense to me. And that took me down the road that said, you know what? I've really spent a lot of time studying one thing. Let me put this on the back burner for a minute, and let me really try to figure out what's going on with this whole chiropractic functional neurology thing. And so
back to your quote from Francis Crick about the entire view of the universe depends on the study of one's own brain.
Mm-hmm. Absolutely, and that's what
I'd written about this, and what I tell people, like when I went off to the International Symposium on Clinical Neuroscience, I'm like, I'm off to see the wizards, and the wizardry is basically stuff that works that most people don't understand why. And so there becomes this like mystical, that's what we call woo-woo. It's things that we don't understand. Germ theory was woo-woo at one point, right? Like, that dude committed suicide because people thought he was crazy, because he was like, hey, wash your hands after you do surgery before you deliver a baby.
Dr. Semmelweis, dear man, yes.
And it's funny you say that, because I used to call Dr. Carrick the Wizard of Oz.
That's awesome.
You'd hear about him. You'd learn seminars with people he taught. But for a while, he was never around. Maybe you'd see him on like a webinar, or maybe you'd see him on like a little Skype thing before a seminar, but you never met the guy. And then all of a sudden, he pops up in my school I happened to be at, not for him, just happened to be there, and he's there. And I'm like, wow, the wizard is out. At that point, to be honest with you, I really didn't have much interest in going down that path. I was very confident where I was going, but I said, what an opportunity to try to figure out what this thing is. And
Huh.
once I figured it out, I mean, I jumped in 2 feet, and I really started getting I really into it, really learned a lot about it. I now teach for him. And that kind of put me into the world of concussion and head injuries and neurological rehab. And
So
so,
which school were you at that he came to speak at?
well, long story short, he came to Life University, a chiropractic school. He didn't have to. He
Yes.
came because what he wanted to do was create a top-level neuro rehab clinic who produces top-level neuroscience research at a chiropractic school to enhance the whole profession.
So this is important. This is what I want to talk about, is why chiropractic is the foundation to functional neurology.
Mm-hmm.
Absolutely. And we could talk about that because, unfortunately, the chiropractic school had a different vision. And they kind of split ways after a year or two. So there's no more association with Dr. Carrick and his work with that school anymore. And then he went to another clinic with a bunch of investors, and they had different opinions, and they split ways, And looking back at it, I'm still with Dr. Carrick, and I believe in what he does. And to go to your point, as far as like what really is functional neurology, what really is chiropractic neurology? What is that term? What does it mean? And I'll tell you my opinion because everyone.
What is kinesiology as well?
Let's go through it. So kinesiology is really just a study of movement. So it's really a study of movement, and applied kinesiology is kind of the study of. This is how I'll relate it. You've heard my talk a little bit about maps of the brain and how we know where we are. And
Fascinating,
if you take a look at how we know where we are, we have a major dilemma because we have this empty space that we have to move around in. I always tell people I teach to, I say, if you had to build a robot, or if let's say 1 million years from now, we go to a planet and we're building another species, what do you give them? What kind of what do you give them to let them move? And you start to realize to be able to move, you need good vision. You need good information from your muscles and your joints and your skin. You need the information from your inner ear to tell you where your head is in space and if you're rotating or if you're translating in the direction you're moving in. And you need good hearing a lot of times. If something's coming out, jumping out at you. Like I teach in Amsterdam, and I don't know if you've been to Amsterdam, but it's a crazy place with all the bikers everywhere. And you can get killed by a biker more easily than you can from a car.
Wow.
So hearing is great to have because when you have a biker yell at you, you know to get out of the way.
And these are bicycles or motorbikes?
Bicycles. These are all bicycles.
Killer bicycles.
Death by bicycle.
Be careful with those bicycle tracks. But so anyway, so what you really have is you have a system that gives your brain information, and then your brain can process that information to create an appropriate response.
Okay.
Mm-hmm.
So what applied kinesiology really is, it looks at movement, it looks at muscle strength, and it allows you to change different information from people's environment to see how your brain responds to it. Or to say it differently, what applied kinesiology really does, it likes to look at weak muscles. So let's say you're with an athlete and he has like a tight groin and maybe some hip pain, and you take a look and you realize, well, his glute on that side is weak also. And maybe because that glute is weak, maybe that's because the hip is too tight or the hip flexor is too tight. It's causing an imbalance of muscles between the hip.
Okay.
So what you can do is say, well, what can I do to make that glute strong? Mm-hmm. When I was a personal trainer, what I would say is I would do exercises for the glute and I would stretch the hip flexor, and that's what I would do.
Okay, and then?
I looked at applied kinesiology and I said, wait a second. My first experience, I saw a chiropractor adjust the bone C1 on the top of the spine, and I saw a glute get stronger.
Whoa.
I said, wait a second. I don't know any muscle that goes from the top of your spine to your butt. So what is going on here, And so that kind of got me into the whole brain to understand how the impact of your brain on everything you do. You don't need this one-to-one connection where just because you have a weak glute doesn't mean there's a problem with the muscle or the nerve. It could be a problem with how your brain is processing information around you. Mm-hmm. And sometimes I could put sound in your ear. I could move your eyes in a certain direction. I could put light in your environment. I could change the environmental context and make that muscle strong because your brain's processing in its environment differently. So it thinks you're somewhere different. Where if there's a problem with the muscle or the nerve, it doesn't matter really what I do to the brain really, it's going to be weak. But a lot of people have weakness, not because of a nerve injury or a muscle injury. It's because the brain is processing information that's not optimal.
Aha.
So that's applied kinesiology.
Well, one of my favorite examples, my work comes to this point through functional nutrition. And when I was working solely in holistic nutrition, it was interesting because, of course, you get people who people would come to me and they have digestive issues, notably constipation. Well, how do I get my bowels? How can I just? So the conventional treatment, or just I guess the common strategy, is to bulk up the stool and push it through. But once I started learning much more about functional medicine and functional neurology, well, let's take a look at the brain. Let us find out why your gut isn't working from the perspective of the brain function. And what a difference.
Absolutely.
What a difference.
And I can tell you, one of my first patients at school, I worked in this clinic, and it was just kind of like an underprivileged clinic. We had a lot of people who were homeless there.
Okay.
So I had a homeless lady there, and she was constipated. And for 30 years, she took daily laxatives to have a bowel movement.
Yes.
And, and I got put in a position where she didn't have the money for supplements, and she didn't have the money for good food. And, so what do you do? Mm-hmm. So what I did is I said, look, this is what I want you to do. I want you to gargle with water for about 20 to 30 seconds, about 5 times a day.
Yes.
And I gave her very specific eye movements. And I said, I want you to follow this dot. She had a computer. I said, I want you to, I would have put it on a piece of paper,
Yeah.
I said, I want you to follow this dot to the left. Just go to the left and then follow it back to the right. And I had very specific to her brain. And within a week and a half, she was off all of her laxatives and having normal bowel movement with just doing those 2 therapies.
Wow. Isn't that something?
Yeah. You were talking about kinesiology, which is musculoskeletal system, right? Really focusing on that. And then we're talking about, and with chiropractic as the foundation being the nervous system of the spine and how it's relating to the muscles and the bones and the joints.
Carrying all that information from the brain.
Right. We want to go up all the way to the brain.
Yes.
What I call the puppet master, We have the puppet master up there. We have the strings coming down, and that's the spine. And those strings are very important. We got to make sure the connections are made, and those are going to everything, right?
Absolutely.
And that's very important, and it's really cool to see a foundation and then moving up to the brain with something as simple and cheap as eye movements. Just doing simple exercises truly affects the brain and strengthens areas of the brain so that the brain can then positively affect the body by tugging on the right strings.
Absolutely.
Better puppet master means better puppets.
Absolutely. And that's kind of, when I went from applied kinesiology, I got to the point where I said, it went from being the most amazing thing that muscle got strong. And then I got to the point where I said, well, what does that even mean? Because I started realizing that I had miraculous results for some people, and then other people I did nothing with, but my technique was the same. And I realized I need a better measurement than a muscle test. The muscle test is great, but it's not good enough for me. It doesn't tell me enough information. And so that's when I got into functional neurology, because I wanted to start looking at real functions. Like that woman's digestion got better. I improved the function. Someone's moving better. And the way I look at it is people come to see me because something isn't functioning right, or there's something that they can't function in their daily life. Something that they can't do what they want to do. And that's why they go to the doctor a lot of times, because they're limited in what they can function in. So what I need to do is say, what function are you having problems with, and how can I make that function normal? So I started learning how to test all these different functions, whether it's a motor function, a digestive function, and I started measuring actual functions in my therapy.
How much function can you help a patient create in their body if they have neuroinflammation or systemic inflammation. So really, you need the knowledge of that functional medicine, of that clinical nutrition to apply to your functional neurology work, because it's really hard to build a dam while the water's flowing over top of it. But if you can calm down that inflammation and then retrain or rebuild or reestablish neural pathways when the water's calm, you're going to get far more function from that patient.
Absolutely. And I would put it this way. I have a patient that comes in and she's in a wheelchair. She has Lyme disease. And all I do is give her different herbs and things for Lyme disease. And now she's walking. That's functional neurology to me, because her function changed.
Mm-hmm.
You know, so it's not necessarily saying you can't use any type of supplements or drugs or anything and not call it. But like I said, I want to see a function change in my patient. So again, that's just the way I look at it. So if I give people, again, I see a lot of Lyme disease and they have neurological complications. And when I do neurological rehab with them, it's much different than neurological rehab with someone who has a head injury. You know,
Okay.
so again, but what I try doing is I try looking at function, and chiropractic neurology is really looking at the function of your musculoskeletal system and how it feeds into your brain, and how it feeds into your cerebellum. And your cerebellum is really the area that controls all of your function. He's like the guy in front of the orchestra, really coordinating everything.
Okay,
You know?
okay.
So that guy really, the cerebellum really feeds and eats and lives off of movement of your body. So the second you stop moving, and what happens when people get sick? They stop moving. And they start lying down. And the second that happens, the cerebellum stops functioning appropriately, and then everything kind of comes down and doesn't function as appropriate as it should.
And as you said, that's the concussion protocol, is like sit in a dark room and don't move.
Don't move.
Absolutely.
That's right.
Evidence is
That's
showing
the
more and
worst.
more. It's the worst. You know what? The evidence I've seen shows the first 6 to 10 days, if you really try to rehab it, you can make people worse. After about 2 weeks, is really 2 to 3 weeks, is you really want to start getting people doing things.
Okay.
If you wait more than 3 months, 3 to 9 months is the window I've seen in research. More than 3 to 9 months, it's much harder to get people back. Not that you can't. I mean, we've had patients years of trouble that get back better, but it just makes it a little more difficult than if you could get it right away and catch it right away.
Of course, absolutely. So all of this, you're talking about all of these inputs coming in and feeding into that small part of the back of the brain, that hindbrain, the cerebellum. How does this figure into what I've heard you talk about as brain maps? These seem really critical to developing our functional movement.
Absolutely. So when you think about, let's talk about moving your hands.
Okay.
For me to move my hands, I need to know where my hand is. So in 1990s, it was kind of like the decade of the brain. They put a lot of money in our government to try to understand the brain better. And one of the big things they found, which was groundbreaking, was the fact that we need the sensory information from our body to be able to have a motor output. So in order to move anything, I need to know where something is. So without the information from my hand telling me where my hand is and receptors in my hand giving my brain information of where my hand is, if it's moving, is it flexed, is it extended, I can't move it because I don't have a starting point to go from point A to point B. Or to say it differently, for me to move, I need to know where I am initially and where I want to end up, and have a plan to go from point A to point B. And in order for that to happen, I need to have the point A. Where is my hand? And what's amazing is if you take a look at the research, every movement you do, your brain has processed that movement 17 to 25 times before you move.
Oh, wow.
So 17 to 25, just as simple as picking up a glass, 17 to 25 times your brain has played that movement over and over again in its mind, say, to figure out how to do it the most effectively. So by the time you make that movement, you've already processed it up to 25 times.
In that
So
instance,
what you're saying is that you want to pick up a glass, your brain rehearses how you're going to pick up that glass 15 to 25 times. Is that what you said?
Yeah, about 16 to 25 times.
Okay. It thinks about and plans out how that's going to happen before you even do anything.
Absolutely. Between your brain and your basal ganglia, these guys have these loops, and it's all about planning and figuring out. Your brain is all about efficiency. So this is, again, I started with this quantum. I read a lot of quantum physics as this energy medicine. So I started in this quantum physics world, and then I kind of got into this neurological world. And the way I think about physiology is it's a non-linear dynamic system.
Okay.
So right away, as a clinician, I throw away all kind of flowcharts.
Yes.
Not that I don't look at them, and not that they're not handy to have, but one flowchart will almost never work the same for the next patient because everyone just has a soup of stuff, and it's just too complicated. So when I look at concussion and Lyme, I look at a two-way street where when I look at concussions, in my brain on the most simplistic level, I say, this person's ability to organize chaos is off. So of course they're going to have poor gut function. Of course they're going to have poor immune system function. Of course they're going to have these certain symptoms because everything won't be organized as well. And it's like, what do you treat? Because if you come from a functional medicine background, all you look is blood levels, then you're going to see blood levels. If you come from a rehab standpoint, you're going to see, you're going to see what you see. But the fact is, the initial thing is the trauma. So unless you do something to get the brain back online to create organization, in my opinion, a lot of other things are secondary. Where on the other end of the spectrum, Lyme disease is just this chronic infection. So let me talk about quick for Lyme disease. I just want to talk a second about Lyme. If you go to a doctor and they talk about Lyme disease and they only talk about spirochete, my advice is that person is not as well educated in Lyme disease as they could be.
Yes.
Because when you look at it, is physically impossible to be bitten by a tick. Now, there's controversy about mosquitoes, about placenta. There's all this. We're just going to keep it simple and say ticks give you Lyme disease.
Okay.
However, you can't find a tick who just has Lyme disease. So if you have Lyme disease, now you have to worry about, off the top of my head, you have to start worrying about Babesia, Bartonella, Ehrlichiosis, Brucella, a whole wide of parasites, mycoplasms, Colorado tick fever, Rocky Mountain spotted fever, Powassan virus, Q fever, tularemia, stari, rickettsia, anaplasma, and that's just the beginning of it. So all of a sudden you have all these chronic infections, and that's not even discussing biofilms.
Exactly.
99% of bacteria in our world, in our body, and in our environment live in biofilms. We're little communities. And they can actually talk to each other with quorum sensing, so they can communicate with each other. And it's like a little community, and the variety is better to have different types of infections together. And there's good, even our good bacteria, the microbiome, for good reason, is becoming much bigger. Your microbiome is all in biofilms. So breaking down biofilms might not be the best thing because all your good bacteria is pretty much biofilms also. And the biofilms help the bacteria hide from the immune system. So we have all this crazy stuff going on. So when you start looking at your immune system being attacked by Lyme, which it does, a chronic inflammation is huge, but why is there inflammation? If you have chronic infections, you're going to have chronic inflammation. And if you only treat the inflammation without the infections, that might not be the most advantageous way to treat a patient, because in Lyme disease, a lot of patients go bankrupt paying for medication and paying for supplements. So I want to have the most cost-effective way to treat somebody. So you start looking at all these infections, and next thing you know, even if the infection's not in the nervous system, which it still usually is, now you have so much chaos that maybe the normal brain can't even organize it anymore. So on one end, a normal physiology with a brain injury could cause chaos chemically because he lost that organization in a chaotic state. On the other end, more chaotic state might just be too chaotic for the brain to even regulate. So some patients I start with saying, look, let's start on a more, I would call it functional nutrition or functional medicine routine. And some patients, I don't do any supplementation with them, and all we do is brain rehab. So it really comes down to, I think, trying to match what you do clinically with what your patient presents with. And so if you look at my clinic, so what we do in my clinic is I want to know how your brain functions. I want to understand how your brain is working. So what do I do to understand the guy that creates organization? The first thing we do is QEEG. We do a whole brain mapping to look at different brain waves throughout your brain.
So what is that?
QEEG.
QEEG it's a quantum EEG. So it's similar to like when people have epilepsy and they look at brain waves to try to find brain waves that are going too fast, causing seizures.
Okay.
And I connected you with my partner, Dr. Kelsey Brenner, who you guys are probably going to talk to. And because that's what she really specializes in. So I could tell you my understanding of it, but she's going to tell you a lot more. What it is, it's a cap. We have a dry cap, so there's no gel needed. So you put a little dry cap on the head, and it's got 19 areas where it measures brain waves, and it'll give you all the brain waves in all different areas, not all, but a lot of different areas of your brain. So you can know, is this area of the brain moving too fast? Is it working too hard, too slow? So if you have depression, you might see areas of the brain firing too slow. If you see anxiety, certain areas of the brain might be firing too fast. So you can start correlating different areas. Frontal lobe areas are going to have different symptoms than parietal lobe areas. So, so frontal lobe areas are firing too high might give you certain symptoms, where parietal lobe areas firing too high might give you other symptoms. So it gives us a map of how the brain is really working. And it's a great way to show the patient, because you get a visual 3D map, and it'll show you every way of how the brain's actually functioning and how fast it's working.
I'm really excited to talk to Kelsey about that.
Yeah. Well, and that's the beauty of the neuroplasticity, because it is so immediate. Like you say, that diagnostic capacity is right before you. You don't have to wait for the test result to come back. You already got it.
Absolutely.
Immediately. Dr. Traster, your information today has been phenomenal, and I think you're right. The three of us could carry on for quite some time yet.
Yes, indeed.
Except that we have to share you with your patients.
Absolutely.
Absolutely.
I do have a patient waiting, but it was great talking to you guys.
Thank
you
so much.
Ever need anything from me, you know how to contact me. Obviously, that's my website, southfloridaintegrative.com. But I got into this to help people. I love being a clinician, and I really wanted to have a clinic, a home base. Because reason I became a doctor is I said, what if I went to that chiropractor 9 years before I did? What if somebody would have taught something to somebody 9 years ago that changed their perspective? Why, if I've done it, which is like, almost brings tears in my eyes sometimes. What if I can create a positive experience, not just for my patients, but for patients around the world, that they could get better quicker, where they don't have to wait 9 years. They don't have to wait 20 years. What if 6 months is long enough? But what if 6 months is better than 6 years? So, and that's why I teach, that's why I do these podcasts, because as long as people think I have something valuable to say, it's my responsibility in my history to do it, because my only objective is to help people. And that's why I got into this profession, to strictly just help people.
Well, we are so glad to help you achieve that, because that is our mission as well. We've been through the ringer, and we think that there is a better way. So thank you for joining us on this journey to share.
I just want to
share. Yeah.
I want to say one thing. I want to say clearly, first of all, congratulations on your new clinic.
Yeah.
Thank you.
I'm excited to see it at some point soon. And I also want to just say you are clearly a man with many tools. And what I was going to say is, when your only tool is a hammer, everything looks like a nail. And you said something to that effect. And so I really appreciate that you have so many tools to work with.
Yes,
absolutely.
yes.
Thank you guys so much. I really appreciate and respect everything you guys are doing, increasing awareness. And I think what you guys are doing is really great.
Yeah. Thanks again, Dr. Traster.
Thank you very much.
Thanks. Bye, guys.
Bye-bye.
Okay, everybody, that's it for the 21st Adventure in Brain Injury. That was great. It's amazing to be able to speak with these brilliant practitioners.
And these brilliant practitioners who are beyond the practice. I mean, to have someone like Dr. Traster, as educated and experienced as he is, to go within himself and search out what else. I just think that we're in a paradigm shift. We're witnessing the left turn of the practice of medicine.
Without a doubt, towards the right brain.
Let's do it. It's been a long time coming.
Towards the right brain. I mean, same thing with Dr. Jerome Lida, where the patient was just in search of what could help them. Yes. And they came to where they came to. And this is why I'm doing what I am doing to promote the safe and effective methods of neurorehabilitation, because there needs to be a change in the standard of care in neurorehabilitation.
Yes.
So,
yes.
Here we go. Thank you for joining me on this adventure, MM. We're doing this together.
It's truly my pleasure, CC.
CC, I call you MM because Michelle Mounberg. Why do you call me CC again?
Because
Does that mean I'm carbon copied in your email?
No, definitely not. You're Cavino from Colorado.
Very nice. All right, well, let's wrap this up. If you guys want to hear more episodes, we're on Stitcher, on iTunes, on Google Play, and head over to iTunes and leave us a review and rate us up there. It helps more people to hear us. So you can go to Adventures in Brain Injury /iTunes, and it'll take you right there.
Perfect. Are you enjoying these episodes and the information that you're learning? You can help us bring them to a wider audience with your support. AdventuresInBrainInjury.com /support. And on the Patreon page, you can support us for $1 an episode, perhaps a latte, $3.42. Sit back, enjoy your cuppa, and listen to the next episode. Thank you.
Thank you. Thank you, Michelle. And thank you guys so much for being here. We will see you on the next adventure.
Goodbye for now.
Adios.
Someone